Olá pessoal, tudo bem? Eu sou a Raíra, eu estou aqui no Hospital Acıbadem, em Istambul, na Turquia. Eu estou aqui na presença do Dr. Abdullah, cirurgião plástico, especialista em hair transplant, em transplante capilar. E eu vou fazer algumas perguntas para ele para ficar esclarecido para todos vocês algumas dúvidas que possam haver sobre o processo de operação, o processo do transplante de cabelo. Well, Dr. Abdullah, I am here to make some questions to you. Okay, so first let's start for your experience. How long time you have been working with hair transplant?
Thank you for welcoming into Istanbul here. We're doing this business maybe 10 years and more than 5,000 patients. We don't calculate them. So it's a long time.
Perfect, great experience. And about the hair transplant, many people are afraid about the surgery is painful. Is it painful or not?
It was painful because we were using a lot of needles that was harmful. Now we're using painless anesthesia. That means we're not injecting anything first. We spray something to the neck area and that makes it numbness. After then we make the local anesthesia. So we can say that it's painless now.
Okay, super. So the patients don't need to worry about the pain.
Yeah.
And how long time is the surgery?
It depends the harvesting and the grafting time, and the approximate times are 6 to 8 hours.
Depend of the case.
Yes, depend on the number of the
The
seats.
grafts, okay. And if the patient is unsuitable, they cannot have the surgery done, they cannot do the operation. What's the advice in this case, and how you detect if a patient is suitable or unsuitable?
First, before coming here, we're asking for the pictures taken from the back, laterals and top. And we want to see the balance at the donor and the affected areas. So if the donor area is so limited or the skin quality is looking not rich for that kind of surgery, so we do not advise. In that type of situations, first PRP treatment or fat injection treatments are necessary before surgery, and it can be get ready before hair transplantation, maybe 6 or 8 months ago, and then we analyze the patient and we prepare for a new result.
Yes, this previous analysis is important because we are not going to do the hair transplant in someone who will not have a good result.
Yes.
So we have other treatment options, but not the surgery. And after the surgery, the hair can fall, still fall or not? After you do hair transplant, this hair will be always there.
There is a result in the scientific studies that implanted hair are not falling. The question why? The answer is that the vascularization, that means new blood vessels are created to supply the new health of that seed. That means that seeds are staying there for lifelong. But we know 25-year-old cases and they still have that hair.
The hair is removed from a strong area of your head.
Not only about the strong area, maybe the implanted hair is enriched by new vessels. So the body is covering it much more than the before.
Okay, and this new hair, this hair implanted, will look natural after the hair transplant or not?
When we prefer the natural size, we prefer the natural angle, and we want to result in a natural way. So we ask the patient's previous pictures and we want to determine the frontal line before the surgery. That means the frontal line it must be expectable for his age. I don't want to make a lower frontal line in a 65-year-old man. So it depends to his life and his lifestyle, and it must be natural and useful.
Okay. Well, I think everything is clear now. If you have questions, please text us. Thank you so much, doctor, for your information.
Thank you. Welcome.
Thank you.